Hello, and welcome to the Harvard Chan School post-election faculty panel and discussion. I'm Meredith Rosenthal, the C. Boyden Gray Professor of Health Economics and Policy at the Harvard T.H. Chan School of Public Health. I'm pleased to welcome my colleagues from the Harvard Chan School and Harvard Kennedy School who are serving as panelists today. I'm hoping they'll let me indulge in a brief introduction of each of them to share some of the highlights of their careers. First, welcome to Sheila Burke, adjunct lecturer in public policy at the Harvard Kennedy School, where she previously served as executive dean from 1996 to 2000. Ms. Burke has also served as chief of staff to former Senate Majority Leader Bob Dole from 1985 to 1996, and as a professional staff member of the Senate Committee on Finance and deputy staff director of the same committee. She was also a member of the Medicare Payment Advisory Commission from 2000 to 2007 and the Kaiser Family Foundation Board, on which she served as chair. She's also an adjunct faculty member at Georgetown University and a distinguished visitor at the O'Neill Institute for National and Global Health Law. We are also joined today by Dr. Howard Koh, the Harvey V. Feinberg Professor of the Practice of Public Health Leadership. Dr. Koh is also faculty co-chair of the Harvard Advanced Leadership Initiative, advancing leadership education and training at the Harvard Chan School and across Harvard University. From 2009 to 2014, he was the 14th Assistant Secretary for Health for the U.S. Department of Health and Human Services, serving under President Barack Obama with oversight of 12 core public health offices, including the Office of the Surgeon General, the U.S. Public Health Service, Commission Corps, and 10 regional health offices across the nation. I'm also pleased to welcome Dr. John McDonough. Dr. McDonough is Professor of Public Health Practice in the Department of Health Policy and Management and Director of Executive and Continuing and Professional Education at the Harvard Chan School. Among his other accomplishments, between 2008 and 2010, he served as a senior advisor on national health reform in the U.S. Senate Committee on Health, Education, Labor, and Pensions, where he worked on development and passage of the Affordable Care Act. From 2003 to 2008, he served as executive director of Healthcare for All, Massachusetts' leading consumer health advocacy organization, where he played a key role in passage and implementation of the 2006 Massachusetts Health Reform Law. Thank you again for being here today. I want to begin by acknowledging that many in our audience and perhaps on our panel are likely feeling a great deal of anxiety about the results of yesterday's election. For many voters and people who are unable to vote but are affected nonetheless by what happened yesterday and what will continue to unfold, the choices facing the country this November have been existential in nature. And as we all cope with the current uncertainty and perhaps grave disappointment with the results and their implications, I hope we can also renew our collective commitment to respectful discourse, mutual support, and service to the ideals of public health. I'd like to outline today's program for our audience. I will begin the discussion with our panel by giving each panelist an opportunity to reflect on some of the implications of yesterday's election results. And I should add the election results that will continue to come out. We will then pursue a conversation among the panel, and we will leave about 20 minutes at the end for Q&A with questions from our Harvard Chan School community members. You can enter those questions in Q&A, and I will be very happy to ask as many of them as from our panel as we have time. So let me start with you, if I may, John. Can you tell me a little bit about what you think we learned from the election yesterday, both the presidential election and the congressional elections, and perhaps if you want to reflect on those as well, some of what's gone on in the states. What are the voters telling us?
Pleasure and honor to be here with you. Maybe we should start just with what we think we know, or what it's looking like, and please, Sheila or Howard, disagree with me. It's looking like at this point that the White House race between Biden and Trump is tipping toward Biden. He seems to have easier routes to get to 270 than the president, and that's not certain but that does seem to be the trend that we're going. It is looking like the Democratic dreams of a big blue wave that would deliver majority control of the United States Senate will fall short, and that Democrats will end up with perhaps 47, 48, 49 seats, subject to change. But again, that's how it's looking right now. Looks fairly certain Democrats will maintain control of the House of Representatives. And unlike their ambitions of expanding their majority, it looks like the majority is going to shrink somewhat. So divided verdict from America. One of the things, happily, that it seems we all agree on is the importance of voting. This was the largest voter turnout at about 67.5% in 100 years. So it's great that everybody agrees that this was a highly important choice. And at the same time, I think it's clear that American society is more sharply divided than perhaps many had thought before we learned the results over the past 18 hours or however long this has been going on. It's clear that the 2016 election of Donald Trump was not a fluke. Just one stat that I picked up: in 2016, 90% of registered Republicans voted for Donald Trump. In this election cycle, over how many days? 93% of Republican voters voted for Donald Trump. So this is not a fad or a passing phenomena. This represents something deeper and more substantial in terms of American society. I think it's also clear that there's a sharp reaction to what's going on in terms of the most urgent issues in front of us: COVID-19 and controlling the pandemic, and the impact of the pandemic on the economy. And it appears that folks who went for Biden were deeply concerned about controlling and limiting the reach of the pandemic. And people who supported President Trump were much more reflecting deep concerns about the economy and not allowing the pandemic to do further, deeper damage to the US economy. And so we again see another stark disagreement. I don't think Americans go and vote for a divided government. I think that most people who go and vote would like to see their side control the White House, the Senate, and the House, sometimes referred to as the trifecta, when you have all three. But over the past 40 years, since 1980, Democrats have had the trifecta for 4 measly years. Republicans have had the trifecta for about 6.25 measly years. And we've had about 30 years of divided government. And so if there's a preference looking at the weight of opinion as expressed by the electorate seems to prefer divided government, and they're going to get more of it over the next 2 years, which means that the ability of either side to forward its agenda in a robust, exuberant way, the way that partisans would like to see their side proceed, is going to be frustrated and thwarted significantly. Last thing I'll say, and I'll stop here, the group that really needs to do some serious head examination after these results come in are America's pollsters. The polling community suffered a major setback last evening. We thought we'd learned from 2016 not to pay attention, but they came forward and said, "Oh, no, we've learned our lessons. We've fixed it." And I looked at the New York Times, I looked at 538, Real Clear Politics, the Cook Political Report, Larry Sabato's Crystal Ball, and a few, just to keep track. And they were all very much in the same place, looking at the potential for a big blue wave. Not certain, but much less of what we saw. And so I just think for the polling community, they've got some serious splaining to do in terms of helping us to understand how we could have been so not intentionally, but so misled by the bulk of consensus within the nation's polling community. And lots more, but I'll stop there.
Thank you, John. Uh, Sheila, I wonder if you could sort of take us from there a little bit as we think about what the implications of the election results and the prospect of divided government, perhaps in particular. What implications does this have for our federal health policy and public health policy going forward, especially thinking about the Affordable Care Act and what is going to happen to coverage reform in the U.S.?
Thank you, Meredith. And let me also thank you for the kind invitation to join all of you today and have the opportunity to join my colleagues and friends in this discussion. Let me begin where John ended. And John did a spectacular job of really touching on sort of the key messages we've gotten from this election and raising some of the real challenges going forward. Like John, I think the pollsters will have a lot to answer for. But I also suspect some of the Democratic leadership are going to have a lot to answer for. The expectation of a big blue wave in the House, an expectation of taking the Senate, and a relatively easy, forward motion for Biden, I think has certainly not occurred. Now, there's a great many things yet to be decided, but I think John's exactly right. Both John and I have lived in a world, and I certainly did in the Senate, of single party control and then divided control. The reality is more frequently divided, and it presents a whole series of issues. And particularly as we focus today on healthcare, there are a whole host of questions that need to be dealt with. Before we know what the outcome of the presidential election is, you've got 74 days remaining of this Congress before they go home for the 117th Congress to convene. And there's a great deal that could occur in those 74 days. So let's look both at that period of time as well as going forward, if in fact there's a Biden administration in a divided government. Even with the disputed election, which is what we currently have, it isn't going to stop the health policy wars. I think they are going to, if nothing else, going to be underscored during the course of this next period of time. The Trump administration has a great deal of tools available at its disposal. He's issued a whole host of executive orders that have essentially led us in a variety of directions in terms of health policy, and making it easier to fire federal employees, for example, or some of the changes with respect to reproductive services, a whole host of things. So we can't lose the fact that, in fact, even if in fact Biden were to win, you've still got to deal with sort of the interim period of time and what can occur at the end of any administration, where they essentially move to get as many regulations out as they can. We know that Seema Verma has continued her interest in rethinking the Medicaid program. A great many changes going forward in terms of Medicaid, allowing states to test out a whole series of issues, not the least of which are work requirements and other challenges in terms of enrollment, the ability to essentially stop enrollment for people that during the course of the COVID virus essentially became eligible, but under somewhat questionable circumstances, to remove them from the rolls. So again, I think we have to continue to focus on where those issues may be. In terms of the Obamacare issue, Meredith, that you raised in the ACA, the near term is on Obamacare enrollment. That enrollment began last weekend. Signups for the open enrollment period began, but there's been little effort on the part of the administration to incentivize or encourage or in fact make that known. There are outside groups that are essentially quite actively engaged in trying to encourage people to enroll, but we've got a host of people that as a result of the virus and the result of unemployment who essentially are potentially eligible, but lots of questions about whether in fact that will be taken up, and essentially whether there'll be a robust effort to essentially enroll and what that might be. Verma has, tweeted about it, but there's been no serious effort, and the funding for that kind of enrollment activity has really been dramatically reduced over time. Again, the Medicaid program, in terms of healthcare issues, they've attempted to fairly fundamentally overhaul the Medicaid program and the safety net programs, resulting in a host of people that essentially lost benefits. And again, the question of the flexibility for the states. And this bears on also the question that you touched on, Meredith, and that is what's occurring in the states, both in the state legislatures as well as in the governor's races. and whether there are shifts. I mean, the states that have in fact pursued these waivers and pursued those efforts, arguably without a change in administration, will continue to do so. And essentially the red states are pushing to revise their Medicaid programs, particularly as they become more subject to economic downturn in terms of their finances. And then, of course, this pandemic, which I know Howard will talk about with far more knowledge than I will, but real questions about essentially what's taking place. What we've seen occur, and I think will be an issue for the Biden administration should they win, is essentially the underfunding and really the failure to support our local and state public health departments over the years. And that has come to fruition in terms of what that infrastructure looks like. And I think from the Biden administration looking forward, that will be a priority. In the near term, there are questions about the vaccine, the distribution, essentially the allocation, what the priorities will be, the acquisition of the vaccines, who gets it, how they get it, when we finally have one. So questions about continued pressure and whether this administration will feel that in the next 74 days to continue to pursue the development of those vaccines. And then the question of, do we have the capacity to distribute, and essentially the decisions on the priorities. So again, I think there's, in a divided government, you're going to continue to see real pressure. And from Biden's perspective, were he to win, the great challenge will be how he moves an agenda forward, and frankly, how he gets his cabinet approved in a Senate Republican environment where there, I suspect, will be tremendous pressure. And he'll have to give real thought to who he puts forward in terms of his cabinet positions and the other positions that are available in a new administration, knowing they're going to face Senate confirmation in a relatively hostile environment. So I'd like to think things will move quickly and there'll be a honeymoon period. I don't think there's going to be much of a honeymoon here if in fact we see a transition. So let me stop there.
Thanks very much, Sheila. Thank you. Well, Howard, I think everyone who's been poring over the newspapers and all those websites John advertised knows that according to the polls, the COVID-19 pandemic was one of the most important reasons that brought voters out to make a decision to weigh in and have their voices heard. So I wonder if you could tell us how we should think about what the White House and the new Congress need to do to get the pandemic under control, not knowing, of course, exactly how the election will ultimately play out. But, what should they be thinking about? What steps do they need to take?
Thank you so much for organizing us today. And it's also a great pleasure to join my friends Sheila and John on this very important panel. So to review, of course, we are now in the 10th month and counting of this very complicated pandemic response here in the United States. I often point out that if you take a global look, places like Europe, the UK, Italy, Spain, elsewhere are going through a second wave because the first wave came and went, and now there's resurgence. But here in the US, the first wave came and stayed and got worse and worse. And so just in recent weeks, we're seeing very disturbing news about record numbers of new cases around the country, approaching 100,000 and more, record hospitalizations, with field hospitals being erected in places like Wisconsin and Texas and elsewhere. Test positivity rising. I just saw that South Dakota has test positivity of 50%, if you can imagine that. And then, of course, deaths rising as well. And you've probably all heard the fact that we in the US lead the world with respect to cases and deaths. So what can we do going forward? We have to remember that we are now in the midst of flu season. We're hearing cases of people getting both the flu and COVID, but so much prevention has not been leveraged yet. And I'm so glad Sheila mentioned the importance of supporting the public health infrastructure going forward, because this is a fast pandemic that came on a slower pandemic of preventable chronic illness like obesity and heart disease and lung disease that made people prone to COVID in the first place. So we need to try to double down on prevention and public health as much as possible, make sure everybody gets the flu shot so we have higher vaccination rates exceeding the 45% that we had last year for American adults. We have to spend much more time talking about the importance of making mask usage a new social norm. We have about 70% of Americans doing that, but we need to get it up over 95% or more. And then, as Sheila has already mentioned, we have to get ready for a COVID vaccination effort, which I hope can come on the foundation of a solid, if not very successful, seasonal flu vaccination this fall and beyond. And then meanwhile, there's research going on in therapeutics. We've seen lots of progress in in-hospital care of COVID patients so that mortality rates have dropped. And we're very, very grateful to the frontline healthcare professionals who are heroes here. But we still have too many people dying in overcrowded hospitals, and we just have to manage this whole system from a clinical but also prevention point of view going forward. And then it's very important to remember that this pandemic has hit various parts of the population disproportionately hard, particularly communities of color. If I can say, as a member of an immigrant family, I follow that very, very carefully. So we have to follow the health disparities and the health equity issues going forward, particularly in a time where racial justice is front and center on the national landscape. So those are some of the themes that we have to keep front and center, and how the two candidates here for president will manage that in the future is a discussion that we should have through the rest of this hour and beyond. There have been many proposals from both sides, lots of discussion about the best way to do this, the role of federal government versus state leadership, and how best we can coordinate efforts. But the bottom line is we've seen too much suffering that could have and should have been prevented, and we can do much better going forward.
Thank you, Howard. So I think you make a compelling case, of course, that COVID-19 is not only an enormous priority due to its impact, but also one where public health has a wide array of tools to offer where we could actually make a difference. I wonder, thinking about the other priorities of the next Congress and the White House going forward, if each of you would take the opportunity to identify what you think should be the highest priority in public health or health policy. And I guess, I would welcome you to also comment on what you think is likely to take precedence, depending on who takes the White House. I think that we can agree that there will be a divided government in any case. So John, I'll start with you. What should be the biggest public health or health policy priority?
So I would add one other element to the COVID conversation. I think COVID is job one for whatever administration, although there's just such a radical difference in approach and prioritizations depending upon who's occupying the White House next late January, February, and moving forward. But one of the big things is that state and local governments are facing a serious fiscal emergency. And there is a big difference of opinion between the House of Representatives and the Senate and the White House on aid to cities and states. And if that doesn't happen, then that's going to drive the economies into much more serious financial emergencies, and will then have spillover effects on state and local ability to address the pandemic and have the resources necessary. So that is a key important emergency. But some other things that I think are really important for the next administration that didn't get talked about a lot in the campaign, climate change kind of got pushed aside, and particularly thinking about the health impacts, the health damage that is done because of climate change is, I think, an increasing priority. You look at the wildfires out west, the hurricanes, the droughts, and the associated health impacts on it. And it is not equal to the task in terms of the public conversation. Also, we need a much more serious conversation and action on the federal level around racial and ethnic health inequities and disparities, and addressing those in a meaningful, serious way. And the last thing I would just mention is something that didn't get talked about at all, which is America's obesity epidemic. Obesity and overweight is over 70% of American adults, one of the highest proportions we see in the world. And it's a desperate issue that has a direct impact on COVID, on chronic disease, on all different kinds of important and vital health indicators. America, the last 3 years, we saw declining life expectancy. I didn't hear that mentioned once at all in the campaign, but it's a reality and a fact. And so there's a big, long agenda, which is why I am so keenly interested in who is going to win control of the executive branch going forward into next year.
Thank you, John. Sheila, I'm curious if you want to add to this conversation about what the public health and health policy priorities should be, and then also if you have any sense about what a Biden administration, what a Trump administration might prioritize in 2021.
Thank you, Meredith. Again, I'm going to build on John's comments, which I think touched on a great many of these issues. I mean, certainly the long-term decisions with respect to the CARES Act and the funding that's being made available, as John pointed out, there are huge issues and a big area of disagreement between the House and the Senate, and that is the support of local and state governments. And the fact that they are in financial disarray, which means they can't support the kind of local activities they would like. The other piece of that, of course, is cash assistance, the absence of unemployment benefits, so that people who are already unemployed under enormous pressure, which brings to mind all the behavioral health and mental health issues that we're confronting. And frankly, the long-term shortage of the number of professionals to essentially care for those individuals, and the absence of, I think, real compliance with mental health parity, that we in fact do not treat mental health in the same way as we do other services, and have made it very difficult, particularly in rural areas and other areas, to make services available. As a side note, I think one of the things that the pandemic has brought to bear is a whole question about how we deliver services. And this rethinking of where services occur, how best to support people, what the provider mix looks like, the introduction of telehealth in a much more dramatic way. I mean, Medicare has seen massive, as you know, Meredith, massive increases in the number of telehealth visits. So I think it's caused those of us who are health professionals to step back and think, what do we need to be doing? How should we be doing it differently going forward, given the circumstances that we're now confronting? But certainly the support of local and state health departments, certainly the support of individuals in employment, and looking at where those shortages exist. The issues about disparities. I mean, one of the things that's been brought into focus that Howard mentioned is the disproportionate impact on communities of color. But one of the things that we have seen in addition to this issue is the extraordinary number of maternal mortality occurrences among people of color and women of color, and the sort of disparate treatment and the availability of services. And that comes back to Medicaid and the coverage, and whether we cover people prenatal as well as postpartum, and for what period of time. Lauren Underwood, who's a congresswoman, who's also a nurse, I would underscore. Lauren has focused on this maternal mortality issue, which I think is a huge issue for us to focus on going forward. I also would be remiss, given my history on the Finance Committee, not to mention the long-term entitlement programs and the funding. Big issues around Medicaid and Medicare. In the context of Medicare, will it be available? How do we finance it? Do we rethink the age of eligibility? Both of those were areas that the Biden campaign touched on, and that is, how do we look at the long-term financing for the Medicare program and the support of that program? And again, what could occur in terms of the aging of the population and really the presentation of chronic illness, as John points out, which is a huge compelling factor for the Medicaid program and the Medicare program, given that most of Medicaid is long-term care, and the Medicare population, again, as you know, Meredith, the old, those over 85 that are growing at an extraordinary rate. You know, the good news is we live longer. The bad news is we live longer with a lot of conditions that are being taken on by people of a certain age, seniors. So I think all of those things are things that any administration are going to have to confront. And the answers to those questions will be radically different between a Biden administration and a Trump administration, and what the tools are that they use. But I think all of those things are things that need to be touched on, again, as we go forward.
Great. Thanks so much, Sheila. And Howard, you gave a really compelling case for investment in the public health infrastructure and the specific tools that we need to combat COVID-19. Do you want to say more about health policy and public health priorities that you think the next administration should tackle?
Sure. So this is a opportunity, if I can say, for us public health professionals to keep our perspective broad. One prominent example I can put before everybody is that there have been a couple of studies now from CDC and one published in JAMA by Professor Steve Wolf of Virginia Commonwealth University, showing that if you look at excess deaths in 2020 compared to previous years, of course, there are many excess deaths due directly to COVID, about 2/3 of them due directly to COVID. But another third of excess deaths are indirectly related to COVID. That is, people, for example, with heart disease and stroke present too late or not at all to their healthcare providers, and so they die when they didn't have to die. Another example of how the whole system has been disrupted here. And then John has mentioned very nicely how we've had chronic conditions like obesity feeding literally this fast pandemic, and all this should have and could have been prevented much, much better. So going forward, we need to keep this perspective broad. Also, it's really important that we understand that our good health is not just physical health, but also our mental and social well-being. That's what the WHO definition of health is all about. I mean, everybody has felt the emotional strain of isolation and lack of connection through COVID. So those are issues we have to think about broadly in terms of helping each person reach their highest attainable standard of health. And then in an era where we all understand that social determinants really drive our health in very profound ways, can we use this terrible challenge as an opportunity to have the various sectors of society work more closely to get to a better place? So for example, I often point out that this time of COVID, you've never heard so many people talk about health, public health, and business in the same sentence. We all see how important it is to have a healthy society in order to have an economically thriving society as well, and not to mention the impact on schools and the educational sector together. So as we go forward, can we have an administration that encourages all sectors of society to work together to address all the terrible ramifications of COVID on us? And that's the challenge, I think, going forward.
Great. Thank you so much. I want to go back to this question of divided government, and in general, regardless of the outcome of the final counts from this election, the sense that we will be in a pretty unsettled place in this country politically. And maybe I'll ask John and Sheila, who've spent some time in Congress in various roles, to reflect on where do you think the folks in the White House and in Congress are going to be able to find common ground politically when it comes to these health priorities that you've all laid out. And we can imagine one group or another focusing on some of them, but where might there be common ground? John, do you want to start?
Well, I think that there are areas where it's possible for the administration, the House and the Senate, if the Senate under Republican control, if that's where it's going, to agree on goals and some priorities that need to be addressed. I think all parties down in DC, both parties, all three centers of government, believe that some further public action is needed to address the pandemic, and some kind of a relief package. That's a place of common ground. And then there are just sharp, deep disagreements over what that should be. I think that, for example, as Sheila mentions with the entitlement program, one thing not many people are paying attention to, but which is a big and nearing issue, is the part of the Medicare program called Part A, which is the hospital program and the hospital insurance trust fund that is funded by payroll taxes that pays for hospitals' involvement in the Medicare program. It was just a few years ago not supposed to go into a financial cliff until 2030. It now is scheduled to face running out of money beginning in 2024. And depending what happens with the pandemic, that could even advance to 2023 or 2022. So I think that all parties will be able to come together and say, yes, we need to address that, and we'll agree to focus on it. And where it gets really hard and really sticky is what then would they agree to do to try to fix the finances of the Medicare program going forward. I think some things that were very much on people's minds, if things go the way they're going, are kind of off the table. For example, just one relating to the Affordable Care Act, the idea, the proposal of adding a so-called public option to the Affordable Care Act, which Joe Biden has been very supportive of, with a Republican-controlled Senate, is a no-go and just ain't gonna happen. And there's nothing to be achieved there except for making noise at this point, because there's just no way they will permit that to happen, and they would welcome the chance to publicly reject it. So there are some things where it'll be easy to find common ground. There's other areas like expanding and addressing the affordability challenges and related issues with the ACA that I think are going to be, again, perilously difficult to find common ground. But just one silver lining, I just saw it today that there are some folks in Texas, some Republicans in Texas, who are saying, geez, maybe it's time that we expand Medicaid under the ACA, given everything that's going on. So wonders never cease in this world.
Thank you, John. Sheila?
Careful what you wish for, John. They may put some tags on that Medicaid expansion we may not be happy with. Well, there are a couple of things. Let me identify, before I get to the small list of things they can agree on, a couple of complicating factors. One, we don't know what the court's decisions are going to be. I mean, there are a couple of huge issues that are going to come before the court, the ACA being one of them, and how Congress would react, should they react to essentially an ACA decision that essentially strips coverage. You may find that even Republicans are interested in trying to figure out the solution to that question. The other is reproductive rights. And as you've seen all these cases coming up from the states in terms of limiting reproductive rights, whether or not there is a push, again, not likely to be an area of agreement, but that's likely to engender a whole series of conversations. But two areas that come to mind, in addition to the package that John talks about in terms of support, whether it's unemployment, is an open question, the support of state and local governments. Red states are just as concerned about this as the blue states in many cases. But you've got drugs and all of the conversation we've had to date about drug prices and whether or not there is any attempt to try and find a middle ground in terms of drugs. You've got surprise medical bills, where there is an interest between both parties in trying to figure out what the resolution is, whether it's a negotiated resolution or not. Bill Cassidy is among the Republicans who's tried to work something out or talk with the House folks, who seem, at least some of them, interested. And the other is, again, this question of how we rethink how we deliver services and how we finance them, and the role of telehealth. We've expanded it dramatically, largely under waiver. A lot of interest on both sides of the aisle in terms of whether we continue to push that. Questions about, quality and about controls and about fraud and abuse, but nonetheless an underlying issue by the Doc Caucus in the House, which is largely Republicans led by Dr. Burgess and others, but interested in expanding, particularly if they represent rural areas, finding different ways to provide services to people, I think will be something where there is a great deal of interest. And this question John raised about the financing of the entitlement programs, and Medicare Part A obviously comes to mind because it's payroll tax financed. It will be hard to come to a resolution. And again, you may see a decline in the trust fund again because of COVID, because of the issue of the financing, which is payroll tax finance. If you have fewer payroll taxes, you have fewer money going in, but you see a lot more people drawing services. And there will be a question about what are the array of options that people ought to consider. But again, I think drugs, I think surprise medical bills, I think, the expansion of how we deliver services are areas where there to date has actually been some interest in trying to figure out how best to do that, and efforts to try and figure it out. The other will be something that Howard will have thought about, and that is whether they can come to an agreement on the distribution of vaccines, and whether or not, because they're likely to involve the military, They're likely to involve state and local governments, whether we can collectively agree on what the priorities ought to be, first responders, the elderly, whatever it happens to be. So I think those are areas one hopes they can come to closure on.
Thank you, Sheila. And momentarily, I'm going to turn to audience questions. I have a couple of questions, and I encourage people to go ahead and submit questions through the Q&A. But Howard, I wanted to return to you, and as we were just talking about what is the art of the possible, and in the current political climate, I'm wondering, you've been involved in developing pandemic planning documents and protocols for the Commonwealth of Massachusetts, for the country. Is there a place where we could start with a real forward-looking plan and for preparedness for the next pandemic threat? And where might you find traction in doing that in the current environment?
Thank you, Meredith. Yeah, so where Sheila ended off was actually a great place for me to start, because if we're looking for common ground, trying to get consensus about how a future COVID vaccination effort proceeds is critically important. We all know that Operation Warp Speed has been moving along. There's some debate about that term, but the good news is it's a public-private partnership that's evolved over a number of years through multiple administrations. We did have a time in our country about 15 years ago where flu vaccines were produced by only one pharmaceutical company. And I remember that time. It was very tenuous and fragile. So fast forward to 2020, we have 5 phase 3 vaccine candidates for a COVID vaccine. And everybody agrees that we should have at least one of them crossing the finish line by the end of this year or the beginning of next year. And then, as Sheila mentioned, what's different about Operation Warp Speed is it's not just an HHS and private company effort, but it also involves the Department of Defense. So how they help and support and work with state and local health departments is going to be absolutely critical. It would be great if we could say that all these parts of government were working together to accelerate distribution to the right people at the right time. And then the key question that Sheila is raising that we all have to watch very carefully is how will this be distributed? Because at the beginning, there are always challenges with having supply meet demand. So I hope everybody is watching carefully that every state and the National Academy of Medicine has put forward these priority groups for who should get COVID vaccination and the various phases by which it could be distributed and disseminated, starting with healthcare workers and essential workers, as Sheila mentioned. Lots of discussion about how people of color should have their needs addressed. And actually, our Dean Michelle Williams has weighed in saying that that decision may perhaps rely more on their social vulnerability because it's social factors that are causing them to be vulnerable, not biologic factors. And then, of course, people who are older with comorbid conditions. And so there's a very good national debate and discussion going on about those priority groups. And so by the time a COVID vaccine is finally authorized or approved by FDA, I'm hoping that we can have consensus both nationally and state by state about how that should be proceeded. If we can make that work and show the American people that public health can actually protect everybody in a unified way, that would be a huge win for us, regardless of who the president is.
Thank you. Thank you. Thank you all so much for the first part of this conversation. We're going to transition now to the Q&A, and I have a few questions teed up. And again, I would encourage people to add their questions to the Q&A. One of our audience members comments that perhaps the results are not an accident or a problem of polling, but in fact are the result of systemic voter suppression. And the audience member comments that, how should we think about addressing the health effects of this kind of suppression? Ultimately, the relationship with racism and all of the mechanisms through which people are affected. So I guess the question seems to be, it's a big one, a two-part. One is sort of how do we get the system to really respond to the population in a more representative way? And I think in the meantime, how do we begin to address the effects of systemic racism and the other drivers of inequities that we've been talking about earlier? Anybody feel like they want to jump in there?
Let me just jump in on one piece of it, not to answer it as much as reflect on how best to think about this. I mean, we had, as John pointed out, importantly at the outset, the most extraordinary turnout we have ever seen. And I think there will be a great deal of attention paid to what that turnout looked like, to what extent it reflected the population. We know there are reported cases, for example, Texas, where they, cut down on the number of boxes. I think there'll be a great deal of attention and interest in understanding who voted. Was it as expected? Was it reflective of the community that was essentially involved? To help us understand where, in fact, there was an impact in terms of voting. Now, what we don't know, I mean, we may know totals, but the extent to which they discard ballots or disallow ballots, under what circumstances, and what does that look like in terms of reflecting the population? Are the frequency of ballots from communities of color more frequently rejected than others? So I think there'll be a great deal of interest in understanding that, that will help us look at some of these issues. On the broader question of the disparities, I think there is a real effort, and I would think one over really needed in the context of healthcare. And that is, how are we training our physicians and nurses and others? What are we providing them with in terms of tools to understand sort of, bias that exists that may not be essentially deliberate, but is a function of the way they've either been trained or practiced or exposed to group practice or exposed to communities. I think that is an ongoing question. And I'm sure Howard has a point of view, and I know medical schools are looking at this, certainly nursing schools are looking at this, but I think there is a broad community-wide effort that has to be undertaken to sort of really address inherent bias that we may in fact not fully recognize.
Thank you, Sheila. John, I have a question that I think is tailor-made for you. One of our audience members said neither Trump nor Biden ran on a government-run healthcare platform, which seems to be a hugely missed opportunity, and they cite some polling numbers, especially given the current pandemic. So what do you think is the future of the American healthcare system? In particular, with this question of, are we moving towards something more holistic, something more like a single payer system? Why are we not moving in that direction in this election?
Well, we're not moving in that direction because I think that there's a recognition that trying to achieve a Bernie Sanders style Medicare for all system is a political bridge too far, at least in the current climate, and that it could not pass Congress. And whatever Joe Biden might think of it, I think he's smart enough to recognize the political reality that it just wasn't going to happen. And so there was the formulation of the idea for the public option as something that creates a little bit more of a bridge into a potential pathway out of a system so reliant on employers who provide more than half of the coverage to Americans. And as we've seen in COVID, can be a difficult pathway in terms of people having secure health coverage. So there are just so many disagreements about it, and there's so much conflict associated with it. And it's hard to see how it gets from here to there in terms of the Congress. I don't even think there's a majority in the Democratic-controlled House that would embrace Medicare for all. But there is an ability to come together, I think, to expand and improve the documented and well-recognized and understood shortcomings of the Affordable Care Act right now, and making it more genuinely affordable and creating some other kinds of reforms in there. But it's going to be very challenging even to advance that in divided government with Mitch McConnell running the Senate. I just don't see a lot of space there to try to do that, which is why I thought, when people thought that there might be a Democratic trifecta, there was great interest and excitement about finally having the opportunity to go in and fix some of the deficiencies in the ACA that people have recognized for a decade now. And at least right now, it appears like even that may be a bridge too far. And it just reflects how conflictual and ideologically divided the healthcare policy space is when it gets out into the public.
I have a couple of more questions that are really related, and we've been, I think, talking about them all along, which is sort of how do we think about what polarization is doing to us, both as a country, but also to our health policy priorities. And of course, Joe Biden ran on unity, and it's unclear where we will be after this week in terms of whether that message will continue to resonate, regardless of the outcome of the election, or whether people may be fed up with polarization to some extent. So the question is sort of two-part, or two people actually. One is sort of what is the implications of that polarization for our health policy, but also, can we see some progress in thinking about when we're talking about public health and health policy, trying to move us more towards a unified electorate?
Maybe I can start. I've had the incredible privilege of being a public health official under multiple Republican governors when I was Massachusetts Commissioner of Public Health, and then a Democratic president when I was Assistant Secretary for Health. So, health should be a bipartisan, if not nonpartisan issue. And I think the best public health professionals and leaders are the ones who can bring everybody together, especially in a time of crisis like this, and send the message, how do we avoid going through something like this ever again? Look at all the preventable devastation we've had here and now the polarization. We have to tackle this head on and unite across the country. And then we have a rapidly growing country, which is getting more diverse by the day. We're going to be a majority minority country by 2045 or so. And then we're getting more diverse, not just by race and ethnicity, but also by sexual orientation and level of disability and rural versus urban. We have to have more of a united effort for the United States. So I'm hoping that starting with a effective common ground with respect to COVID vaccination that Sheila mentioned, talking more about how do we cover more people, even in the absence of a Medicare for all type situation. How do we, most importantly of all, revitalize and refund public health at the state and local level, particularly, not just federal, so we don't ever go through anything like this again. I think this is where the public health community here has a great opportunity to make a contribution, so the students here can be the future leaders. And then we want an administration that empowers public health and lets them do their job so that we can get to the other side of this and make sure that we don't go through this ever again. So that's my hope.
Wonderful. Thank you, Howard. Sheila, did you want to add something?
Yeah, I would like to and do endorse Howard's thought, but I will tell you that I am concerned that the divide is much deeper than we have seen in the past. I mean, if you think of post 9/11 and think of when the country's gone through crises, in many cases, it's been an opportunity to come together. That was certainly true after 9/11. And what I think striking about this situation is how deeply divided people have been around the response. I mean, the impact has been now widespread. I mean, we're seeing, Howard's pointing out, the infection rates out in the West, in the mountain states and other states. So it's not just an East Coast phenomena. It's not just a New York problem. It's not just, the sort of coastal crisis of New York, California, and who cares about the, flyover states. But it hasn't brought us together, which is what I have found stunning. And I am hopeful, were it to be a Biden administration, he has a history of having reached across the aisle. He's done it on a variety of issues over the years. And I think that would be a difference rather than a combative environment between, the blue states and the red states and an administration that drives that division. But I am concerned that the depth of the disagreement is so deep that it may take some period of time. And to Howard's point, if we can begin with some areas, maybe it's the vaccine distribution, maybe it's some element of the public health situation where we try and address it. But I think generationally, we're deeply divided between the old and the very young. certainly by race, that we are deeply divided. And I think it's going to take some extraordinary efforts to try and find common ground around areas where historically you would have imagined there was agreement, but there just seems to be such a deep divide. And I worry how quickly we can essentially begin to address that to get to the end that Howard's described.
Thank you, Sheila. Thank you. Thank you all. I know that we are coming very close to the end of the hour, and so I want to take this opportunity to thank our panelists, Sheila, Howard, and John, on behalf of our viewers and the Harvard Chan School community, and of course, on my own behalf. Thank you so much for joining us today. These are challenging times, challenging questions. You've provided a lot of insight for us to reflect on, and I hope that we'll have the opportunity as a community to come together and find ways to address the critical public health issues that you've all raised, no matter what happens in the election over the coming days. So thank you all, and thank you to our audience and our online audience, and thanks very much for your questions.